We begin with breaking news from the Public Health Agency of Canada. It has now been confirmed one of the Canadians linked to the cruise ship hit by the Hantavirus outbreak has tested positive for the Andes strain of the virus. Health officials had identified the case as presumptive positive. That was pending further testing at the national lab. The person's partner also showed mild symptoms, but their test came back negative. All 4 Canadians who left the cruise ship last week remain in isolation in BC. And while health officials say the risk to the public remains low, some experts say they expect to see more cases.
So on paper, it looks great, right? We knew who was on the boat. We knew who might have been on a plane with an impacted individual. Those people have all been identified. They're all in isolation. There's access to testing. This is exactly how you manage a response. I mean, obviously, I hope the person who tested positive does well. We wish them, a full and complete and speedy recovery. It's just not surprising that this person tested positive, and we'll likely see more people test positive this upcoming week because of the longer incubation period and the multiple exposures that occurred on the ship. But I think Canada's doing a pretty good job here. We've heard about it. There's good communication, rapid turnaround time of the testing, isolation, and care for people. What I'm concerned about is, what are the other countries doing? I mean, we have people from the ship repatriated to over a dozen countries. If everyone's taking the same steps that Canada's taking, we're going to be okay. If they're not, this is going to grumble on much longer than it needs to.
The Public Health Agency of Canada says a second person who traveled with that person who has the confirmed case has tested negative for hantavirus. But how concerned are you that symptoms might surface in the other individuals, and how often should they be tested?
So it's not entirely clear. We've known about this virus for 30 years, so it's not like we're starting from scratch. And there's some really good data from prior outbreaks with this virus. But let's not also pretend that we know everything about it. I think it's reasonable to screen people, either if they develop symptoms or with some degree of periodicity, maybe once a week or so, to ensure that they're continuing to test negative. There is data demonstrating that people might have evidence of the virus a few days to even over a week before symptoms develop. So you can screen early and detect that. It's great to hear that close contact has tested negative, but again, it's got a long incubation period, and this person will need periodic symptom management and periodic testing throughout that entire incubation period.
That was infectious diseases specialist Dr. Isaac Bogosh.